Three famous men share their struggles with prostate cancer. Learn to spot the first signs and symptoms. Famous American actor, comedian, and filmmaker Ben Stiller was at the prime of his life when a shocking discovery almost turned his world upside down. He got diagnosed with prostate cancer in his late 40s, which was completely out of the blue. He had no symptoms of prostate cancer, no family history, not even in the high-risk group. The only thing that probably saved his life was the regular blood testing that picked up elevated levels of the PSA protein produced in the prostate. This can be an indicator of cancer and was the reason Ben Stiller was able to get medical help at the right time. Bewildering, isn't it? It's weird to think how cancer can creep into your life slowly and steadily without giving any sort of warning. So, how do we protect ourselves against it? What symptoms to look out for? We'll be sharing anecdotes from celebrities who battled prostate cancer and learning about this dreaded disease. Ben Stiller credits the PSA test for saving his life. When his blood test picked up high levels of PSA protein, he got further investigation done, and the results were no less than horrifying. It was discovered that he had a mid-range aggressive prostate cancer with a Gleason score of 7 out of 10. Wondering what the Gleason score is? It's a grading system used to help evaluate the prognosis of men with prostate cancer using samples from a prostate biopsy. The higher the number, the more is the likelihood of spreading of the cancer cells. Unfortunately, Ben had a faster-growing cancer. He opted to have the prostate removed, which proved to be the best decision. But what about possible erectile dysfunction? If you've heard about prostate surgery, you might have also come across the risk of side effects, like impotence or erectile dysfunction. So, how true is that? Do you have to say goodbye to physical intimacy with your partner after the surgery? Well, it depends upon certain factors. The prostate is a small gland about the size of a walnut, situated between your bladder and rectum. When trying to remove the prostate gland to treat cancer, some tissues surrounding it are also removed. On either side of the prostate gland lies a bundle of nerves responsible for causing an erection. If one or both of the bundles of nerves get damaged during the surgery, you may have to deal with erectile dysfunction. Your doctor will try their best to preserve the nerve bundles, but sometimes the cancer is so close that there's no option but to remove the nerves as well. Even if your nerves were preserved during the surgery, you might still experience short-term erectile dysfunction. As the area heals and swelling subsides, you'll be able to maintain spontaneous erections as before the surgery. So, is the surgery still worth it, even if you have to deal with erection troubles? Absolutely! As Ben Stiller puts it, the question is about being able to live, or continue enjoying the act of making love. Getting rid of cancer will triumph over everything else. Don't you agree? John Kerry's diagnosis is a real eye-opener. Imagine you go for a routine blood test. Your PSA levels are well within the normal range, yet your doctor recommends a biopsy. Most probably, you'll want to stall this one. Why on earth would you want a biopsy when your blood tests say everything is normal? US politician John Kerry probably thought the same, but decided to stick to his urologist's advice and went ahead with the biopsy. He was still in his 50s at that time, but had a family history of prostate cancer, as his father passed away from the same disease. As you may have guessed by now, John Kerry did get diagnosed with early-stage prostate cancer, which had a Gleason score of 6 out of 10. Since his cancer was caught at an early stage, John made a full recovery after treatment, and the cancer hasn't returned since. So, what led Kerry's doctor to recommend a biopsy? His PSA level was within the normal range, wasn't it? As it turns out, the doctor realized that though the PSA levels were not high, they have increased at an alarming rate in the last 2 years. This indicated something wasn't right. John Kerry's experience highlights the importance of cancer screening. You have to take preemptive steps to look for cancer before it shows symptoms. Prostate cancer screening. There are no standard prostate cancer screening tests that you can order from a health brochure. Instead, there are 2 tests you can get done as per your doctor's advice to screen for prostate cancer. Number 1. Prostate Specific Antigen or PSA test. We've already seen the importance of PSA tests through the real-life experiences of Ben Stiller and John Kerry. As we highlighted earlier, your prostate makes a substance called PSA. The PSA blood test measures the levels of this substance. A higher number indicates possible problems with the prostate gland. Please note a higher level of PSA isn't always indicative of cancer. The levels can be affected by medications, medical procedures, or an enlarged prostate. A prostate infection might also mess up PSA levels. Number 2. Digital Rectal Examination (DRE). During this exam, a healthcare professional will insert a well-lubricated, gloved finger into your rectum to check the prostate gland for any sign of abnormality. DRE is not recommended as a standard screening test, though. Robert De Niro credits early discovery for his full recovery. Popular American actor Robert De Niro is another celebrity who made a full recovery after an early diagnosis of prostate cancer. And like Ben Stiller and John Kerry, he too had the PSA test to thank for saving his life. Like Kerry, De Niro had a family history of cancer. His father died of cancer in 1993, and 10 years later, the then 60-year-old De Niro was also diagnosed with prostate cancer in 2003. He continued working during the time he struggled with cancer. After a thorough treatment and a strong commitment to a healthy lifestyle, he made a full recovery and is living a cancer-free life. In fact, in the year 2011, he welcomed his 6th child after the whole ordeal. May he continue to live a happy and healthy life. Prostate cancer symptoms. Famous men struggling with prostate cancer do put things into perspective. You realize how this disease can strike anyone at any time, and your best defense against it is early diagnosis. Please keep in mind that prostate cancer is unlikely to produce any symptoms in its early stages. However, it's important to know about a few signs that may signal something is wrong with your prostate gland. Look out for blood in semen or urine, burning or painful sensation while urinating or ejaculating, frequent urination, erectile dysfunction occurs all of a sudden, difficulty starting or stopping urination. If you are in the high-risk bracket for prostate cancer, discuss preventative and early detection plans with your doctor. Men with a family history of this disease should be extra careful. There was a time when prostate cancer was considered a disease of the elderly, and there was a reason for that. The majority of the cases were diagnosed in men above the age of 65. But there have been cases where men as young as those in their 30s got diagnosed with prostate cancer. So better to be vigilant than sorry later. Do keep in mind that the likelihood rises sharply after the age of 50. Do you know anyone who has battled prostate cancer? What led to the diagnosis? Share your thoughts and experiences in the comments below. Would you like to stay at the top of your health? You can choose to stay informed by watching our other health-related videos. We'll see you there.